Hello, I'm Andrew Thim, and today I will be presenting on a computational fluid dynamic model simulation of immunotherapeutic antibody transport across the blood-brain barrier after focused ultrasound. Typically, the blood-brain barrier, or the BBB, is almost completely impermeable to large molecule therapies like antibodies. This BBB does not allow diffusive or convective flow of these antibodies into an interstitial space like in a tumor. And obviously, we want to increase the amount of the therapy going into a tumor in that specific example. And so, with focused ultrasound and microbubble intravenous injection, we can reversibly and temporarily open the BBB to allow for extravasation of these antibodies into the interstitial space so they can have their therapeutic effect. So, to this end, we want to design a tool and a mathematical model to help us better understand what mechanisms are at play when we open the blood-brain barrier and we see this increase in antibody delivery. This, we hope, will be used in future mechanistic studies so that we can parse out some of these individual components like sonoporation and these tight junctionings opening up. So this is our 2D geometric model of blood-brain barrier. We have four compartments. We have the arterial lumen, the endothelial lipid bilayer, intracellular endothelial space, and interstitial space. We generated a heterogeneous adaptive mesh that ranges from 1.5 micrometers all the way down to 1 nanometer, and we did this for computational efficiency because the endothelial lipid bilayer space is so small relative to the scale of the entire model. These are the governing equations that we use to model the antibody transport. We modeled flow in porous media in interstitial space, intracellular endothelial space, and the endothelial lipid bilayer. We modeled laminar flow in the arterial lumen from left to right. We then modeled drug transport in all four of these compartments, and we modeled the drug kinetics only in the interstitial space. On the right in panel B and C, you can see the boundary conditions that we used to start generating this model. So how did we incorporate focused ultrasound into this model? We altered the intrinsic permeability of the endothelial lipid bilayer, and that actually is a generic term for basically just how permeable this lipid bilayer is, and that encompasses any type of active or passive transport that might happen, like sonoporation or endocytosis. So when we ended up modeling this, we get this massive concentration gradient from the arterial lumen into the other three compartments. Most of the change in concentration happens in the endothelial lipid bilayer and then goes into the intracellular endothelial space, and then eventually we'll get to the interstitial space of the tumor. And you can see that when we alter the permeability by 100-fold over the course of a 60-second sonication to mimic our focused ultrasound, we get a 540-fold increase in the concentration of the antibody post-FUS. So, in conclusion, we are currently developing a model to take into account the focused ultrasound opening the blood-brain barrier via the permeability opening in the endothelial lipid bilayer. So we would like to, in the future, actually start dissecting the permeability, maybe adding other mathematical terms to account for active uptake like endocytosis or passive uptake like sonoporation and the tight junctions opening. And even further than that, we would like to eventually start separating out these therapeutic molecules. So instead of just looking at antibody delivery, which can be around 4 to 5 nanometers in size, we could look at nanoparticle delivery, which can range anywhere from 1 nanometer in size to 100 nanometers. And so being able to differentiate the effects of particle size and passive versus active uptake will help us design better therapies for the future. I would like to acknowledge my advisor, Dr. Price, and his mentorship on this project.